And that's an important thing to remember, is that not everybody at any given time is a good candidate for fasting. There are many people where fasting would actually be contraindicated, where it would do more harm than good. For example, if you're pregnant or lactating. If you're lactating and you try to do a prolonged water fast, you're going to lose your milk production, not a good thing. If you have anorexia nervosa, which is actually a neurological condition that where people want to fast, they perceive themselves as being very large, even though they might be emaciated. Fasting is not for the treatment of anorexia nervosa. If you're a type 1 diabetic, not a type 2 diabetic, which is 95% of diabetics where they have insulin resistance and responds great to fasting. It reduces insulin resistance and normalizes blood sugar levels. But type 1 diabetics don't produce insulin because their islets of Langerhans and their pancreas have been destroyed by their body's immune system. And one of the triggers for that is, interestingly enough, drinking cow milk. If you feed genetically vulnerable kids cow milk, the body's immune system will destroy their islets of Langerhans. That's a large part of what type 1 diabetes is thought to be from. So they wouldn't be able to fast because you need a certain amount of insulin in order to adapt to the fasting process. So without insulin production, it would be very difficult to fast. You'd be very vulnerable to ketoacidosis and you'd get into respiratory problems, and it's not a pretty picture. If you've had a condition where they've had to use anticoagulant therapies, the Coumadin or the other medications that are used commonly for these problems, you would be have to be very careful about fasting, because you can't just arbitrarily discontinue those medications without increasing risk of stroke. And you don't want to fast on those medications, because many of these medications in general can be potentiated during fasting and create a lot of problems that they wouldn't create in the fed state. So that's people that have had like stroke, myocardial infarction, pulmonary embolism, DVT, something where you've had to be on anticoagulant therapy, the Eliquis, the Coumadin, et cetera. Now, those people can sometimes do modified versions of fasting that would allow them to safely continue, but it wouldn't be water-only fasting. If you've had a recent heart attack or stroke, again, oftentimes that would indicate a use of anticoagulant therapy. If you have severe kidney disease where your creatinine levels are over, for example, 2.0, you wouldn't want to do a water-only fast, because the detoxification that happens in fasting is largely done by the kidneys. People think about the bowels, but the bowels really are a secondary source of detoxification. Think about when you put something in your mouth and it goes through the digestive system and eventually gets to the rectum and you push it out the other end. That's never been in the body. It only gets in the body if it gets absorbed through the intestinal mucosa. And so the bowels are not the main source of the toxins in your body getting out of your body. The way that happens is the stuff that's in the blood is processed by the kidneys. It's eliminated in the urine. So it's important to realize you have to have a certain level of kidney function in order to safely be able to adapt to fasting. It's also why we wouldn't recommend, for example, dry fasting, where you're not consuming any water, because then you don't have a solute to put the toxins into and get it rid of. And that will build up and eventually shut down your kidneys. In fact, recently there was a famous internet advocate of dry fasting that passed away, secondary to kidney failure. You know, kind of what happens if you overload the system. So we wouldn't recommend not getting adequate water intake, and you wouldn't recommend fasting in people that don't have adequate kidney function. So we measure everybody's function before we start fasting and monitor it during fasting to make sure that it's working properly and we don't end up with failure. There are genetic defects in rare people. We mentioned MCAD, medium chain acetylcoenzyme dehydrogenase deficiency. That's 1 in 10,000 people, but those genetic defects, other things like porphyria or other things, would be relative contraindications to fasting. If you have deficiency, depletion, or cachexia, fasting may not be for you, because you have to have adequate nutrient reserves. Now, it's true, the body recycles those during fasting, which is why you can go 40 days or longer without supplementation. You think, well, why wouldn't you develop deficiencies? It's because of the recycling efficiency in water-only fasting. If you're on medications, with rare exception, you have to be able to safely withdraw those medications before you would implement water-only fasting. And if you cannot rest, you should not fast. And people say, well, why? If you exercise, you'd lose more weight, wouldn't you? Yeah, you'd lose more weight, but it wouldn't be fat. It would be actual muscle and lean protein. What happens in fasting is the body goes into a conservation mechanism but you still need a minimal amount of glucose. So if you increase your glucose needs by too much brain activity, too much muscle activity, the only place the body can get that extra glucose efficiently is through breakdown of protein.
Even if you're overweight, exercise during a fast is going to result in muscle loss?
Contraindicated. It will. And in fact, we've done a study to prove that. We actually took a DEXA scanner that allows you to do detailed whole body composition. So not just how much fat there is, but how much visceral fat there is, et cetera. And in this study, what we did is we monitored patients before, during, after fasting, actually at 6-week follow-up, and now we're getting 1-year follow-ups too, interestingly enough, in papers that'll be coming out this year. And what we discovered was that the body loses weight during fasting, about 1 pound a day. And it's composed of fat, including visceral fat, protein, fiber, glycogen, and water. And then when you come off the fast, you regain weight. And what you regain is water, glycogen, fiber, and protein, but not fat. When applying a whole plant food SOS-free diet, the fat loss continues. The lean tissue recovers. And in this study that we'll be publishing this year, it actually shows that the lean tissue mass of the individual on recovery is actually higher than it was when they started fasting. And that the fat not only went down during fasting, but it continued to go down all the way through recovery. And that visceral fat was preferentially mobilized during fasting at a higher ratio than anything else that's been shown, including keto diets and all of the other kinds of stuff that's going on out there. That the ratio of visceral fat to adipose tissue is up close to 3.0. So what that means is that a person that might lose, say, for example, 20% of their adipose tissue during a 2-week fast may lose as much as 50% of their visceral fat. And the 4% of lean tissue is recovered during refeeding. And so the overall composition of the body changes when fasting is done properly. Now, you still have to eat well in order for that to happen. You can't go back to greasy, fatty, slimy, dead, decaying flesh processed foods and expect that that's going to happen. But on a whole plant food diet, lean tissue recovers, hydration recovers, fat continues to lose down to optimum weight. So it's very exciting. And again, for people that are interested, they can go to our website. Fasting.org is the foundation's website, and all of the studies that are coming out or will be coming out are listed there, and they can read for themselves the outcome data.
Now, I understand it's not good to fast if you're on prescription medication of any kind. That makes it pretty risky, but you actually work with patients when they come to you and help wean them off medications, yes. Correct? Yes. Before they undergo a fast. What does that process look like?
So it turns out that most people are medicated not for their condition, but for their diet that causes their condition. And so when you change their diet to a whole plant food SOS-free diet, SOS is the international symbol of danger. It also stands for the chemicals added to food that make people fat, sick, and miserable. And those are salt, oil, and sugar. When you take the salt, oil, and sugar out of the diet and feed people whole plant foods, the need for medications begins to drop dramatically. Blood pressure drugs, diabetes drugs. In fact, you have to withdraw those drugs. Otherwise, you end up with problems from excess medication and too low of pressure or too low of blood sugar, et cetera. So we carefully feed and wean those medications. We're fortunate to have medical doctors at the True North Health Center that are not complete idiots, unlike many in our society. And as a consequence, they are used to people actually getting well. And so they understand that just like you have to carefully put people on medications, you have to carefully take people off medications when they're no longer needed. So with the dietary regime, we're able to eliminate the need for medication safely and then begin the fasting process, which even further enhances the benefit of the diet in terms of normalizing the blood values and blood pressure, et cetera.
I know it's kind of hard. Thanks for watching. If you like what you just saw, why not subscribe? Here's a link to do that. And if you'd like to watch the full interview, you can find it at chrisbeatcancer.com. There's a link to it in the description right below this video.